Hi, I'm Darryl Rosen. I am the financial strength coach, and I do these videos to help people like you create safety, simplicity, and most of all, financial strength at any age or stage of your journey through life. A big part of that journey is Medicare, which is why you see Debbie on the screen next to me. I am not an expert on Medicare, so I begged and I cajoled Debbie so much that she agreed to do this video with me. All right, I'm kidding. We're friends and neighbors, but she is an expert. So let's address the elephant in the room. We are it is almost Labor Day, and in the world of Medicare, that has some significance. The Medicare Annual Enrollment period is coming now. That is the correct way to say it. Originally, I said the Medicare Open Enrollment, and Debbie corrected me. That's how nuanced this field is. So you're going to see a deluge of commercials. I mean, they are coming and they are confusing. So let's start our conversation very basic, Debbie. Let's start it by asking, this is a philosophical question. What is Medicare?
So before I answer that, let me just introduce myself. So I work in my family business, and I have been focused on Medicare since about 2008, 2009. I joined my dad and my brother. I used to practice law, and when I had kids and being a trial attorney, that didn't go well together. I love what I do. I spend a lot of my time educating people, helping people navigate Medicare. You got to feel good if you're working with a guy like Darryl, because a lot of advisors aren't thinking big picture, in the sense that they're not always including the discussion on your health care. And that is such a huge component of your retirement. So Darryl, thanks for inviting me on here, and let's talk about it. So back to
viewers, that's the sweetest thing Debbie has ever said to me, just so you know.
He paid me please on the call to say
continue.
It. Yes.
Continue, Debbie.
So just the most basic question, and really the most important way to start, because not everybody knows what Medicare is. Think about it. You have insurance now if you're not on Medicare yet. It gives you hospital coverage, it gives you doctor coverage. When you turn 65, you're now going to be eligible for Medicare. And it's the federal health program, and it is the exact same function, the exact same purpose as what you have now. But you got to understand how to, sign up for Medicare, which is going to be the best path for you. There's lots of different things to talk about.
So where's the best place to start? So we're doing this video to try to educate people who are approaching Medicare age, which is 65, but not everybody has to collect Medicare. If you're working, and I'll let Debbie go through the nuances of if you're working at a specific company that has health insurance, she'll cover that. But the other side of that is that you may think you're covered and you're not, and then there are penalties. And
oh my God, Darryl, too many things you're throwing out there. So let me jump in.
Okay, fine.
A couple things. Let's break it down. First of all, you started with a really great point that in the fall, there are going to be millions of commercials bombarding you. And here's what's so important to understand. When you are not on Medicare, those commercials are coming on strong this time of year because the Medicare Annual Enrollment period is coming up. And like he said, not open, but the annual. And I want to make this distinction. It's so important. So if you're not on Medicare, that annual enrollment period is not about you. That's not when you're going to be signing up for Medicare. That is that time of year where people already in Medicare have the chance to make changes for their healthcare coverage for the next calendar year. So from October 15th to December 7th, that's when you're making the decisions for a January 1 start. And it's really, if you put it in a framework that makes sense, it's no different than what you do every year, whether you're in the marketplace or you have some sort of a group plan that you're making decisions for your healthcare for the next calendar year. So let's think about that. You have those people already on Medicare, and then other people who are approaching it and trying to figure out, are they going to be starting Medicare? So back to your question, or your 50 questions or statements, Darryl, let's go and let's break it down for a second, okay? So for those of you not on Medicare yet, what's going to happen is you're going to have what's called your initial enrollment period. It's a 7-month period when you turn 65 that you're allowed to enroll into Medicare. There's a lot of rules that come along with that. So what you want to do is you want to start talking to an expert. You could follow someone like myself or Darryl or different people on the different social media platforms that we talk on, where you can get an education, So bottom line is that for those of you approaching Medicare, the way you're going to start is you need to first figure out, are you taking it at 65? That is when people are first eligible to take it. Now, the exception to that, of course, is some people are on Medicare earlier than 65 if they qualified based on disability, if they're on SSDI. But otherwise, it is 65 for you. And it's for you specifically, not your spouse. So just because you're turning 65 does not mean that your spouse also can start Medicare. Did you want to jump in? I see you sitting there. You got a question for me.
I have a lot of questions. So,
okay.
What if you're working?
Okay, great, and probably the most important question, because I get so many calls from people who are working. They're a little bit panicked because they're not sure. They have great health insurance through their work. They're not sure if they have to start Medicare. So here's the deal. If you work at a company with 20 or more employees and you are in a group plan, then by law, you have to be treated the same as the younger employees. You can keep that plan and you will not get penalized for not taking Medicare, and that insurance will serve as your primary insurance. Now,
so Debbie, people would generally, do you find that when people call you and they're panicked, it's because they want to keep the current healthcare coverage that they have?
It's a combination. So sometimes yes, but it's more that they're like, wait a minute, Medicare's approaching. They're hearing that they could have big penalties if they don't sign up. So they want to know what do they need to do. And you always, first of all, need to talk to your HR or employer relations, because you need to understand exactly what you're in, and is it the type of plan where you could keep it as your primary insurance and not be penalized later for not taking Medicare at 65. It also could be your spouse's insurance. So the point is, that's why it's so important to start talking to people that know what they're talking about with Medicare. I still get confused with different questions that are thrown to me. I like to think I like rules. I like laws. I like to read about this stuff, and it gets confusing. So always seek out HR, but also an agent, somebody that specializes in this, that really cares about the process.
When do you think somebody should start to consider their options?
That's a great question. So I get that all the time. Definitely you want to start to understand at least like that 6-month mark before because there's a lot of people, especially people who are planners, who think ahead of time and they're worried. To me, if someone wants to reach out to me when they turn 64 because they want to understand, I'm fine with that. We've mastered the whole Zoom meeting, through the pandemic. You can reach out to me. We can hop on Zoom for 10 minutes. It's just about getting that answer. So you can start, but typically if you're really approaching Medicare and you're about to make decisions, anywhere from 6 months to 3 months before your 65th birth month. Now, I say it that way because if you're born, let's say your birthday is September 27th, you don't start Medicare on September 27th. You get to start Medicare on September 1st. And I want to tell you one caveat to that rule. If you are born on the 1st of the month, then your Medicare start date is actually the 1st of the month before your birthday. So just know that.
I've seen that.
Yes.
I've seen that.
So there's no confusing rules here at all, right?
Right. No, it's all, it's all about the rules.
Yes.
Going back to if you're working, I understand that the number is generally 20 employees. Is that so? If you're in a mob, like a mom or pop business, why can't I say that? If you're in a smaller business, that has 3, 4, 5 employees, so you're really going to be going for Medicare. Is that?
You need to, because what happens in that setting, and there can be some exceptions, so that's why you got to talk to your HR. But in that setting, When you become eligible for Medicare, that smaller group is no longer a primary insurance for you. The way the rules are written, if you only kept your plan and you didn't get Medicare and you had a bill for $10,000, that smaller plan typically is not going to be on the hook for that 80% of the bill. So, and I've had people where they have made that mistake and their insurance didn't catch it and they were fine. But you don't want to put yourself in that position, because the rules are that as the 20 or more, that remains your primary insurance. If you are in a smaller group, it is not. And so you would be stuck with just a secondary payer.
So speaking of somebody that might get a $10,000 medical bill, what if you're ill when you turn 65? Can Medicare say, nah, we don't really want to cover you?
No. So here's the deal with this. So there's no pre-existing conditions when it comes to Medicare. And I don't want to overcomplicate here, but you have a choice when you start with Medicare. You either go original Medicare, you get a Medicare supplement and a Part D plan, or you go Medicare Advantage, okay? So here's what's important. When you first sign up for Medicare and you start your Part B coverage, and you have to have Part B, whether you're in original Medicare or Medicare Advantage, but you start your Part B, you have a 6-month period where you can sign up for a Medicare supplement plan without underwriting. So let me back up for a minute, because that's confusing the way I explain that. With original Medicare and Medicare Advantage, there are no pre-existing conditions, but we know there are dollar gaps in original Medicare. Like we talked about the 80-20 split, Medicare covers 80%. People get a Medicare supplement plan to cover the gaps in original Medicare. The first 6 months when you turn on Part B, you have a 6-month period where no Medicare supplement company can ask you underwriting questions. And I want to clarify this, because this is where everybody's mind goes. Well, wait a minute, you can't ask health questions anymore. Well, that's Obamacare, that's the ACA. With Medicare supplement policies, that's private insurance, and they can ask underwriting questions. So that's the only time there's a 6-month period with Part B where they cannot ask you any qualifying health questions. So just to give you an example, Darryl, to follow up with my thought here, if you chose original Medicare and you waited till the 8th month, and not you, but your neighbor did this and he has cancer, most of the Medicare supplement companies are not going to take you as a policyholder. Now, there's a couple of states that have certain rules, different rules, but for the most part, that would be a problem for the person who wanted original Medicare and never got a supplement.
So what do you think about, so I won't ask you, does Medicare have a cost? Medicare has a cost. Everybody should know that.
Has a what?
And a cost. It's not free.
Mm-hmm.
Yeah, it has a cost. And
yeah.
So as I understand it, there was a big increase into the current rates of $170.10 for the base rate. And so we have all this inflation, and that's all everybody talks about is inflation. And when I go to Potbelly's every other day, I know what inflation tastes like.
Okay.
So the question is, and there was an Alzheimer's drug. There was a talk about a drug that was sort of priced into the model, and then it turned out that, well, nobody even really knew if the drug worked, which was a different story, and that they've managed to sort of work around that. Where do you think the price is going for? Actually, I should say, when is it announced? The new price, and like, what's your educated guess on that?
So, Darryl, I keep this snow globe on my desk, and I have no idea. I don't have a magic globe or I can't see into the future. I don't know when it's going to be announced. It should be in October. I don't know if it's going to go up or down. There was so much talk in the early 2022. You just referred to that whole thing with the Alzheimer's drug, that this big increase was in there because of that. There were a lot of people hopeful it was going to drop. So for 2023, is it going to stay where it's at because they did too much of an increase in 2022? Is it going to drop? Is it still going to go up? I have no answer to that. And hopefully we'll know in October. We will know, because they have to give the new numbers for the next calendar year. So,
and as you know, because we've talked about this before, there's something known as the hold harmless provision, which is it's more a Social Security concept, because some of the Medicare premiums come out of your Social Security if you're collecting, and so they pledge to hold you harmless in that. Now, some years the increase in Social Security for the cost of living is very pedestrian. It could be 1 or 2%, but healthcare costs typically rise at least double the rate of inflation. There's a lot going on right now. So what we'll likely see this year, I think we can probably agree on this with a decent amount of certainty, is that we know that there's going to be a big cost of living increase for Social Security. Yes. And so there's no possibility that there can be an increase in the cost of the Medicare premiums that exceeds that. They pledge to hold you harmless. So that's actually an interesting thing. That's a good thing to think about.
I'll tell you this. Well, go ahead. I thought you were done.
No, you.
No. So the hold harmless rule. Okay. I do a lot of these videos on TikTok, and I had a really smart guy that was, reaching out to me from Florida, asking me, sending me articles on this rule. Honestly, I have never, ever had it come up. I've never seen the impact of it. I know there's something where someone's taking their Social Security versus not, and how it protects them. But unless I was rereading an article right now in front of me, I couldn't answer that question, because it's not part of my day. And from a practical standpoint, you're right, the rule exists. I've never seen it impact anybody. I've never seen it applied. And one thing I learned when I was practicing laws, I would never answer a question I don't know the answer to. I would take out my materials, I would reread. I don't know how to answer it, because, and I went through this whole exercise with someone because he was very concerned because he wasn't taking Social Security yet, and he was afraid he wasn't going to be protected by it. But I've never seen anybody affected by it. Or not protected. So you, the financial guy, you look at the math, you tell your viewers about it, because I don't know the answer.
I wasn't asking a question.
Oh, I thought you were.
I was just educating because you have educated so much that I feel inferior. So I wanted to do a little educating.
You brought me on here to strut my stuff, so that's what I'm doing. There's no inferiority here.
So all right, so let's do this. Share with the group how they can get a hold of you, and we'll put this information in the comments underneath the video and what have you, so that when people have questions, what should they do?
So if they want to reach out to me, they, of course, can call my office, which is 847-675-3600. We have our website, GM Goldman. What is my website? gmgoldman.com. And you can always go there. But the bottom line, and you can check me out on TikTok if you just want to start learning. It's the Medicare Advisor. So those are the ways to reach me, or you can reach out.
And that's Medicare Advisor. Medicare Advisor, right?
With an O, Advisor. Yep.
Advisor. Okay. And one last thing before we finish this, and that question is, you are licensed to help people. Like, we're in Illinois. We live in the suburbs of Chicago. But you are licensed to help people that live all over the place. Is that right?
So what's been really, over 30 states. With all the work I've been doing on TikTok, like you, it's brought me nationwide. And working with my brother, we keep adding states because
people need help.
People need help, and so we're not in all 50, but it keeps growing. We're somewhere between 30 and 40 states.
Okay, so before we end this, the viewers should know this is the first time we've done this. Yeah. And it's the first time I've operated the technology that allows us to go from here. Excellent. That allows us to go back to here.
Yeah.
So we appreciate you watching.
So you never did a close-up of just you. You just did them with me. Ended on you, a close-up.
No, nobody wants to see me. So Debbie, are we going to do this again?
Absolutely. If there's questions that you want to talk about, I'm
okay. Well, I have time.
I love educating. I love talking. Believe it or not, I actually really do love talking about Medicare. I love learning all the stuff and then sharing my knowledge. So absolutely.
Cool. Well, I appreciate your time. Have a wonderful holiday weekend.
You too.